how do you recover from a concussion? So, I mean, the simple answer here is just time. Concussion happens, it creates this transient metabolic or energy deficit within the brain and affects some of the neurophysiologic processes that, like your parasympathetic, sympathetic nervous system, heart rate, blood flow, etc. in the brain. Now, that just takes time to heal. But I will say that don't use that as an excuse to not take an active role in your recovery. There are things that can be done to speed the recovery of a concussion, at least from a symptomatic standpoint. From a metabolic standpoint, there isn't a lot that can be done that we know of, at least yet at this point, that can speed that type of recovery. But in terms of ameliorating your symptoms and feeling better, there's a lot that can be done, and most of it centers around rehab. Okay, much of the research shows that medications are not very effective at treating concussion. Some things can be useful in the short term, and I know people will prescribe various things. They can be useful in the short term, but they also can come with side effects, and sometimes the side effects of those things can look a lot like the symptoms of concussion, and some things get very confusing when you're trying to figure out, is this concussion now, or is this simply a side effect of the medication that they've been put on? So, treatment for concussions, you're not going to find it in a pill. Most of the evidence surrounding concussion treatment and speeding concussion recovery has to do with rehabilitation. And this comes in a few forms. Number one is exercise. There's been a ton of research which started being posted surrounding using subsymptom threshold exercise as a form of concussion treatment, but it was mostly done in people with persistent symptoms. So this research really started around, the 2 to 3 month mark after injury, even longer, and it started showing beneficial effects, that people that were told to rest and do nothing all of a sudden started getting better when they were given an exercise protocol in a subsymptom threshold way. Now, you can't necessarily just do this on your own. You have to undergo some sort of testing to determine what your threshold is, and that can be done through various, clinical networks that are out there that can help to establish what your threshold is and give you the proper guidance in terms of an exercise program to start making you feel better. That research has evolved now and moved closer and closer to the point of injury, where now we start doing this at current time at complete concussion management clinics. We put people on the treadmill to establish what their threshold is as early as 10 days after the injury. There's been a few recent studies which require some replication and some kind of higher quality study design before we implement them, but some research has now shown that even as early as day 1 or day 2 or day 3, exercise can actually be beneficial and speed recovery of patients with concussion. So the whole rest and do nothing is out. So although it may take time to recover, exercise may be a way to speed that up. Interesting. Another one is vestibular rehab, which is your balance mechanisms. So people will feel dizzy, people may feel off balance. There's potentially some rehab that can be done depending on the condition that you have that can help to give you some exercises to speed the recovery along. Same thing goes for visual rehab. If you have ocular motor dysfunctions and your eyes aren't working properly together, because sometimes they're not communicating properly after concussion injury, and so they're not tracking appropriately, they're not converging on targets at the way that they should be, and you start to maybe get some double vision, you start to not be able to read properly because you're not tracking the words appropriately. This can be potentially a visual issue that, again, we can look at and test and then give exercises for. And this would be carried out oftentimes by either a trained physio, chiro, whoever, or if you have more significant things, we generally refer to a neuro-optometrist or somebody who's more specialized in that field to be able to actually run through and look at that stuff. The next one is treatment of the neck. So in the previous question, we talked about the biomechanics of injury and how concussion happens between 70 and 120 Gs of acceleration. Well, research looking into whiplash injuries find that whiplash or neck injuries are also related to acceleration. However, those ones happen around 4.5 Gs. So you're talking about 70 to 120 Gs delivered to your head to get a concussion. You're going to take at least 4.5 to your neck. So every concussion, every impact-related concussion is going to come with some element of whiplash associated with it. Some sort of neck, mild strain injury of the muscles and joints and ligaments in the neck. Your neck tells you a lot about where you are in space. Your neck can also refer pain into your head. So if you have some neck dysfunction, you might not even have neck pain, but you might feel it as a headache. Okay, so these types of constant headaches are oftentimes neck tension headaches. So issues in the neck are creating a pain in your head, and you think it's your head, but it's actually coming from your neck. And your neck can also cause dizziness and some of those visual issues I was talking about, some of that tracking visually can actually be related to a neck dysfunction. Some people get these saccadic vision, little glitches in their vision as they do a smooth pursuit. That can actually be related to an issue in the neck, because your eyes and your vestibular system, your ears and your neck are all communicating through the cerebellum to coordinate movement. And if any one of those systems is off, you sometimes will get these little glitches and you'll feel dizzy. You'll feel like you're not quite in the right space. You'll feel just a little bit off, right? And that can be a neck issue. So by getting involved in this rehab as early as the first 10 to 14 days, which the research shows that's the optimal time, at least at this point from what we know, to get rehab started for somebody with a concussion injury. So how do you recover from concussion? Well, it's going to take some time, but also you can take an active role in your recovery and get rehab earlier rather than later, because it's more effective the earlier on you start doing it, the better off you may be, and you may be able to speed your recovery.